The following segment is sponsored by Northern Nevada Health System.
Welcome back to Family 411. We're here at Northern Nevada Health System with Marissa Weaver. You're a clinical dietitian here, and you're talking to us a little bit about celiac disease today. What is celiac disease?
So celiac disease is an autoimmune disease, and for those that have it, when they eat gluten, it actually damages their small intestine and then impacts the way their body absorbs nutrients.
So who's at risk for getting this?
So it's a hereditary disease, so it would be passed down in the family.
So if your mom or your dad has it, then that may be a qualifier for you to have it too if you start feeling those symptoms.
Yep, exactly.
What are some of those symptoms? Like, what do you feel, and when would you know to go to a doctor?
So more common is like the digestive related symptoms. So it's going to be things like chronic, diarrhea that's lasting more than a couple of days, fatigue, weight loss, abdominal pain, or there's also some non-digestive symptoms such as anemia or skin rashes.
Is there a specific treatment for this?
Yeah, so the treatment is actually strict adherence to a gluten-free diet. So learning all the things that contain gluten, cutting those out of your diet, and swapping them with alternatives that are gluten-free.
What foods have gluten in them?
So it's going to be anything with wheat, rye, or barley. So I'll think all like your bread products, most of your grain products. So like pizzas, pastas, crackers, cereals, beer, unfortunately. So really learning to like look at the ingredients labels and swap those out with different gluten-free things.
There's a lot of good alternatives out there these days,
For
though.
sure. For sure. There's a lot of tasty things. The restaurants are labeling things. A lot of food companies are labeling it right on the front. So it's definitely easier to find gluten-free foods nowadays.
All right, good to know. Marissa, thank you. If you missed that, you want to watch it again, it's going to be up on our website, foxreno.com.